Hi, I'm Jonah Comstock, editor-in-chief of pharmaphorum. I'm here at ASCO Day 2 in Chicago, and I'm joined by Henar Hevia and Carolyn Sousa from Johnson & Johnson. I'll let you guys share your titles so I don't get them wrong.
No worries. Thanks, Jonah. Great to be here. So I'm the head of commercial strategy for solid tumors in Europe, Middle East, and Africa for Johnson & Johnson.
Yeah, so Henar Hevia, happy to be here as well. European therapeutic area head, solid tumors, working in EMEA with Carolyn.
Well, let's start with the big news, because you have at least one big abstract, and it's on embargo. By the time this publishes, it won't be, but it's it's big news. Tell me a little bit about what you guys are sharing at the show.
Yeah, it is big news. So it's actually the first abstract that will be presented at the plenary tomorrow. And this is about the data we're producing in localized or locally advanced prostate cancer. So these are patients that have very early prostate cancer, and they're treated before surgery to remove their prostate with apalutamide. And maybe you can share a little bit more about why we're so excited.
Of course, yes, because in J&J we have more than 20 years bringing innovation in prostate cancer, and I think that it's true that we are seeing that number of cancer patients are rising, getting bigger and bigger. So we are moving from being ahead of advanced stages of the disease or to early stages. So we need to act earlier, which means that we are going to have more probabilities to really have more chances to cure, which is important for patients, and is the reason why PROTEUS study is a meaningful step forward to curative intent treatment. Going into more detail, right? In PROTEUS study, perioperative apalutamide plus EDT before and after radical prostatectomy significantly improve outcomes for patients, right? Which type of patients? Patients with high risk localized or locally advanced prostate cancer. So the current standard of care is radical prostatectomy, but half of these patients are going to have or to see the cancer coming back, right? So with this treatment, what we are seeing is that patients were 10 times more likely to achieve pathological complete responses, which mean deeper responses, super important in this type of cancer, and at the same time, meaningful 20% reduction risk in distant metastasis or death, right? Which means reducing the risk to progression, right? Super important as well in comparison to hormone therapy alone. This means really a big achievement, because we are talking here about deeper responses, decreasing risk of progression, really having long-term control of the disease, super important for patients, and really delaying the need of additional treatments for these patients. So apalutamide is potentially going to set a new standard in cancer patients, in this type of patients.
So that's really interesting. Obviously you're saying that the patients do still have to undergo the surgery. Is that kind of inherent to how this treatment works, or is it potentially you could move it into an earlier line even than that?
Yeah, this is what is at the core of this strategy, right? Rather than being focused on advanced stages of the disease, if we want to innovate, we need to act earlier. Why? Because this is the moment in which we have more probabilities to really have improved outcomes, better outcomes, extended survival, and improving the chance to cure. This is the beauty of this study, right? But for that, we need to act earlier. If not, we are going to lose a critical opportunity to really change the trajectory of the disease, right? Which is what we are looking for with this strategy.
Yeah, maybe to add to that. So normally, so apalutamide is currently approved in patients that have metastatic hormone-sensitive prostate cancer. So that's sort of the recurrence after this localized prostate cancer. This is the first time and the earliest that we've ever seen a product like apalutamide, which is called an ARPI, that is being used in a setting perioperative to the radical prostatectomy. So it's the earliest we've ever treated systemically with surgery. And it's the first data that we will have in this type of setting. Again, as Henar said, right, it's a real opportunity that if we act early, we can get much better outcomes for these patients. So super excited. And I think only the beginning, if you look at our portfolio in prostate cancer. I mean, as Henar said, we've been in the space for over 20 years, but we are really building a whole pipeline of various modalities, combination regimens, using precision medicine with this effort to look at how can we treat disease more early in the pathway, or as early as possible in the pathway, to help people live longer.
Talk to me about the modality, the mechanism of action, and what do you attribute this great level of success to?
Yeah, so now we are moving earlier. So we are bringing innovation in at a point around surgery to really change outcomes. But we are advancing an innovative wave of innovation, right? The next wave of innovation in prostate cancer, which includes new modalities, new targets, new synergistic effects, new mechanism of action, new molecules. Because yeah, the unmet need is there, right? For advanced stages of the disease, now moving earlier, but we are not zero patient behind, right? Cancer patient behind. So of course, we are taking care of advanced stages of the disease as well. Yeah, so we are taking care of the next wave of innovation at the same time. Yeah.
It seems like prostate care as an area, prostate cancer as an area is getting a little more attention lately, along with colorectal. You know, you mentioned you've been in this space for 20 years. I mean, how have you seen kind of the larger, the sphere, change over that time in terms of how this cancer is treated and what the, prognosis is for these patients?
It's a remarkable, the difference we've been able to make in helping patients so that to me, the best is if a patient dies from something other than their cancer. And that's where I think we've made tremendous progress over the years. But as you said, prostate cancer is a large opportunity. There's many people that suffer, for many men that suffer from prostate cancer. But I think what's really exciting about our presence at ASCO this year is the strength of the data we're producing in other areas where there's large unmet needs and many patients that are suffering. So for instance, in colorectal cancer, you mentioned, but we're also bringing some really exciting data in head and neck cancer this afternoon, I think, yeah. And as well as earlier today, we talked about some of the data that we have of increasing the overall survival in some atypical forms of lung cancer. So, J&J has a remarkable breadth of products and modalities that we're using to treat many different types of cancer as well. So
that's great. You're bringing you've got a lot of things to present, not you personally, at this Johnson & Johnson, a lot of things to present this year.
Yeah, we are moving from prostate to lung, to bladder, to colorectal cancer, to head and neck. So we are really advancing the next wave of innovation, providing practice changing impact, right, with the solutions that we are bringing, because we are committed not only to really improve clinical outcomes for patients, but also to really optimizing treatment experiences. In this Congress, we are going to present very meaningful data about, patients having better experiences, right, while being under treatment, which is at the core of our purpose as a company as well. So we feel super proud about, moving forward, not only with efficacy, but also optimizing quality of life for patients. Lots to present this year.
Great. What have you been seeing and hearing in terms of kind of what do you think the big trends of this ASCO are? What are people going to be talking about when they talk about ASCO 26?
Wow. As every single year, we are seeing many things moving forward. So as you were mentioning before, right, as new mechanism of action, new modalities. For example, in J&J in prostate cancer, we are pursuing KLK2, which is a very novel mechanism of action. We are the only company we are pursuing this novel mechanism of action, but we are seeing other mechanisms, other target drivers, cancer drivers, different oncogenic pathways, and precision medicine is one more time a very important theme that is being seen in every single presentation. So yeah, it's very exciting, right, to see how science keep moving forward, and we are bringing hope to patients in oncology. So yeah, very exciting in the Congress one more time.
Yeah, I'm hearing a lot about precision medicine, especially the diagnostic screening side. You know, sort of the other half of the equation of precision medicine seems to be getting a lot of attention this year.
Yeah, no, and I think this is where there's such a great opportunity. So we've been partnering to look, for instance, at liquid biopsy testing, much more convenient, right, to take a blood sample than a tissue sample. And then maybe staying with prostate cancer for a moment, right, looking at those patients that might have a mutation called BRCA, in which case they are much more likely to have a poorer prognosis. And if those patients are treated with one of our other products, niraparib, then they're more likely to have a better outcome than with apalutamide, right? So it's really, again, a first with J&J, where we're bringing precision medicine, really treating the specific targets and offering better solutions for patients based on what the genetic mutation is that's driving their disease.
This is Carolyn's preferred topic.
Yeah, but you have to, in order to do that, in order to move to early stage, you have to catch it early, and you have to find those patients.
This is critical.
Absolutely. And I think this is where a forum like ASCO provides us such a remarkable opportunity, right? Because, for instance, we're moving from here to go meet with one of our really important patient advocacy groups and talk about how can we help patients have their diagnosis sooner, be aware of the symptoms that could suggest they may have cancer, and then helping to get more equitable access, especially to genetic testing, which I have to say in Europe is one of the challenges that we continue to face, where we may have products approved for the treatment of a particular mutation, but the testing itself is not reimbursed in the country. So I think that's one of the challenges that by having us all together here in Chicago, we can look at how can we solve challenges like that in the healthcare system as well.
Wow, you make a really interesting point that when it comes to something like screening and diagnostic, there's an economic problem, there's a sociologic problem, and then there's a technology problem, and you've got to solve all those problems and find all the partners and stakeholders to do that, right?
Yeah.
And we can only do it as a partners and as a group.
Yeah, for that communication is key. So it's about collaboration, communication, and to have this type of congress is a great opportunity, right? Represents a great opportunity to have this type of conversation to really envision what are the next steps to keep advancing, to keep providing impactful practice-changing impact, right? Which is something that is a common objective that we have, working in oncology.
Well, thank you both so much for chatting with me. Congratulations on the plenary paper, and it's really a pleasure to hear about what you guys have been up to.
Thank you very much. Thank you. See you next year, right?
Yeah, thank you very much. See you next year, Jonah.